there was a bit of a backlash in terms of with your earlier studies looking at hypnosis and how you single-handedly made hypnosis okay for in terms of gut-directed hypnotherapy okay in the Netherlands. Is that correct?
Well, yeah, that's completely true. So it started when I went to a symposium in Nice in France. Mm-hmm. And there I heard Peter Warble, who's a gastroenterologist, talking about hypnotherapy and irritable bowel syndrome. And he showed these unbelievable results, and I didn't believe any word. I thought, okay, this is nothing. I couldn't believe that everybody was cured and that quality of life and everything was better after getting hypnotherapy. And then by coincidence again, I don't know if coincidence exists, but by coincidence, I sat next to him at the dinner, and we had a very nice talk. And I asked him, do you think that hypnotherapy would be nice for children as well? And he said, oh, I think it's much better because children, they are not biased and they can handle these exercises. And if he shows these results, why shouldn't I try? Mm-hmm. And I had this cousin who is a hypnotherapist and asked me for years, please send me some patients. I thought she was mad or so. I didn't believe her at all. And I thought by myself, okay, let's try. So I sent her 10 patients, just a pilot. And well, many of these children did very well. And I was fascinated. So I thought by myself, okay, let's do a randomized controlled trial like Peter Warble did. Nobody wanted to give a grant for this. So I paid it myself. And after 4 or 5 years, we had this incredible result showing that I was able to successfully treat 25% of my patients, whereas this lady who was outside of the hospital and was not using drugs or foods or whatever, she successfully treated these children in 85% of the cases. But then I was really surprised that some of the professors in our hospital thought that I was a fool, and I was not very honest, all very, very nasty accusations. So I was surprised that although the results were so good, that so many people didn't like the form of treatment we did, because they said this is not this doesn't belong in academics. So, but I'm surprised that people don't like it because it's called complementary medicine. And that might be one of the weaknesses of hypnotherapy until today, because we don't exactly know how it works. But if you ask parents and patients, then they're very happy with it.
There's a lot of areas of medicine that we're not really sure exactly how things work.